and welcome to another Mark Bishop Show. You know, Medicaid offers families peace of mind knowing they and their children are covered during COVID-19. Did you know that? Well, Alberto Gonzalez Jr., he's a senior strategist for the Health Policy Project at Unidos US, and he's a health policy expert on how families can enroll for coverage any time of the year. He's my special guest for this episode. Welcome, Alberto.
Hi there. Thank you for having me today.
Well, more than 70 million Americans receive health coverage through Medicaid, including nearly 18 million Latinos. Now, thanks to the Affordable Care Act's Medicaid expansion provision, roughly 3 million low-income Latino adults gained coverage through their state's adoption of Medicaid expansion. So, Alberto, more than half, 55% of the nation's Latino children get their coverage through Medicaid or CHIP. So what is CHIP?
Yeah, so CHIP is a children's health insurance program. So CHIP and Medicaid work closely together. And like Medicaid, is an important lifeline for millions of Americans, including Latinos, and plays a particularly important role during these tough times. You know, Medicaid and CHIP are both low-cost or free health insurance programs that can help you get the care you and your family need and avoid large medical bills. And so Medicaid and CHIP are maybe an affordable coverage option for those who are unable to afford health insurance through the Affordable Care Act marketplace, or who may be unable to access health coverage through an employer. So for those who have lost or changed jobs, had their hours cut back, had any major life changes, or simply need some assistance, they may be eligible to apply for these programs.
So how has Medicaid / CHIP impacted the Latino community?
Absolutely. So as you mentioned, we know that 18 million Latinos are covered by Medicaid, and it's a critically important program for Latino children across nationwide. And you know, we know that states, with states that have taken up the Medicaid expansion provision, we know that it's been a critical life source for our community, especially during this time. But we also recognize that there's still a lot more work to be done. You know, Unidos US, in partnership with our partners at Georgetown University, we published a report last year about Latino children's health, and you know, showing that the uninsured rate for Latino children has actually increased. And in 2019, it actually increased up to 9.2%. You know, and this is before COVID. So we know that COVID has exacerbated the situation for many families across the nation. And we know that many states have now expanded their Medicaid program as well, including Texas and Florida. And so, you know, Medicaid has impacted, and you know, we need to invest and strengthen the program nationwide so that many more Latinos can access health coverage under these programs.
Well, 1.6 million Latino children were uninsured in 2018, and Latino children are nearly 2 times more likely to be uninsured than non-Latino children. Medicaid provides free or low-cost health coverage to some low-income people, families and children, and, I believe, pregnant women. Alberto, what is covered and who is eligible for these programs?
Yes, so Medicaid provides comprehensive health coverage and covers doctor visits, hospital visits, prescription drugs, immunizations, mental health care, and treatment for pre-existing conditions, and more. You know, in some states, Medicaid could cover dental as well. And Medicaid eligibility is based on you and your family's current circumstance. So if you have children, are pregnant, are working in a low-wage job, or have a disability, you may be eligible to enroll in Medicaid or the Children's Health Insurance Program.
Yeah, well, you know, the Medicaid eligibility, of course, is based on an individual's or family's current circumstances. I mean, if you, as you say, lost a job or had your hours cut, are newly pregnant, or have a disability, you still may be eligible to apply. Eligibility varies by state, doesn't it? And it's independent on household size, monthly income, and the family's circumstance.
Yes, that's correct. And, you know, as I mentioned before, some states have expanded their Medicaid program, which means that more people are able to access Medicaid in those states. But we have more work to do to make sure that all other states take advantage of this option. And especially during this time, we know that We have families that are struggling to put food on the table to make ends meet. We know that there are people out there trying to find a new job, and Medicaid is an important option. It could be a temporary resource for families to get covered, and Medicaid and CHIP coverage, gives you and your family peace of mind, just knowing that you and your family are covered during these trying times. And so we're encouraging and raising awareness about this program with the community so that we are able to ensure that every eligible member of our community takes advantage of these critical programs.
Well, we know that more than half, 55%, I think, of the nation's Latino children get their coverage through Medicaid or CHIP. How can families with eligible children enroll in the coverage today?
Yeah, so families can apply for CHIP or Medicaid by visiting healthcare.gov or by calling 1-800-318-2596 to learn more and to see if they're eligible for Medicaid or CHIP in their state. So when you visit healthcare.gov and input your information, you will be directed to, if you're eligible for Medicaid, you will be directed to your state's Medicaid agency website. So again, it's healthcare.gov, or you could call 1-800-318-2596 to learn more. And I'd also encourage you or viewers or listeners to visit our website. It's unidosus.org to learn more about what Unidos US is doing around Medicaid and other health coverage options that you may learn about. And we have information in both English and Spanish as well.
Now, in the couple of minutes that we've got left, I'd like to ask you just a couple more, Alberto. Is there an enrollment period for these programs?
There is no enrollment period, so you could apply for Medicaid or CHIP at any time for you or your children. We know that COVID has impacted us in so many ways, and so even if you previously applied for Medicaid, you may be and you were denied, you may be eligible this time around if your income status has changed. So, if you've lost your job or in between jobs or just need some temporary assistance, you could apply for Medicaid, and you could enroll or disenroll at any time. So it's an option out there for you to take advantage of during these times. Mm-hmm. And again, it gives you peace of mind knowing that you and your family are covered.
I mean, this may sound like a dumb question, but why is it so important for children to have health coverage, Alberto?
Well, we know that there are many benefits that come with having health coverage. And for children, there's been research that shows that children that are covered perform well in school. We know that right now during this pandemic, there's a lot of stress on children, given the virtual learning setting, given COVID, and Medicaid provides mental health coverage services as well. And, in addition, in the long term, other studies show that childhood coverage under Medicaid results with long-term benefits, including educational attainments and being able to contribute to the local economy down the road in terms of high-paying jobs. There's a lot of positive long-term impacts that come with having children being covered at such an early age. Mm-hmm. But we know that there are some immediate concerns impacting the community with regards to COVID, mental health. But again, wanting to emphasize that this option is available, and when you enroll, you have peace of mind that you have coverage, that your family is covered whenever you need it, but especially right now during this environment.
Yeah, it's a very worrying thing for parents, but a little bit of comfort, isn't it, and relaxation when your little ones can be looked after. You mentioned a site before. I highly recommend listeners, you can go onto this site and have a good look at everything he was telling you. It's www.unidosus, one word, okay, Unidos, UNIDOS, US, unidosus.org, not a .com, it's a .org. Everything's on there, isn't it, Alberto? You can have a good look.
Yes, you could. We have information in English and Spanish. We also have affiliates. We have over 300 community-based affiliates across the country. And in a number of states, we have affiliates that are helping to provide enrollment assistance for Medicaid. So again, visit our website, unidosus.org, to learn more about Medicaid and the importance of having health coverage during this time.
Good job, Alberto. Ladies and gentlemen, Alberto González Jr. He's the Senior Strategist for the Health Policy Project at Unidos US and is a health policy expert on how families can enroll for coverage at this time of year, a very important factor. Thank you, Alberto. We appreciate your time.
Thank you so much.